Hi everyone, Jeremy and Dr. Wilson from Phoenix International Stem Cell Clinic. We've been asked today to tell you guys, and particularly you skiers, how we help our skiers in Norway get their movement back, okay? So as we get older, the more we damage our joints, they stop healing, start becoming painful. That's why at Phoenix International Stem Cell Clinic, we use stem cells and concentrated movement to help our patients' joints heal. This gives them less pain, more movement, and a better life. So typically, we find our skiers are coming to us with knee pain, hip pain, and often lower back pain. Now, first, we'd just like to explain to you guys why your joints stop healing and why they become painful.
So, as we age, our joints lose the ability to regenerate. Now, you can think of this kind of like if you had a 100-year lease with property, and your expenses, they go up over time because as time continues, you obviously need to do more maintenance to keep that property in good condition. At the same time, your income, if we want to call it that, stays the same. And so in the analogy, as your expenses go up, at some point you will cross what you can afford to pay, and that means that you will end up with a lower amount. You'll be eating in your savings every month. You'll be losing some of the quality of this property to the point where it's no longer, it's just a wreck.
Exactly, and so that would be like you end up having to start using your credit card to pay off your mortgage or pay for the maintenance on your house without having any extra income coming in. And that's how we do when we have a stem cell deficit. We go into stem cell debt, we start having degeneration, things stop healing, start becoming painful. Now, the two traditional methods we've had to try and combat this issue is to, one, give painkillers, okay?
And painkillers in our analogy would be like saying, okay, I owe money, you're in debt, but I know how to get out of this problem. I'll turn off my phone, I'll throw it away, I'll stop reading my mail, and that way I won't be receiving any bad news. That's what painkillers are like. They disconnect you from the issue, but they do not give you any improvement.
Exactly. We're not doing anything to try and fix the problem. We're just trying to stop the message making us feel bad, okay? And then the second most traditional option is surgery, okay? And that would be like, knowing that you've got massive debt, you've got credit card debt, you can't pay your bills, and so instead of actually addressing the problem, you decided, let's cut and run, okay?
And so a surgical procedure, often you end up with a prosthesis. These things are made out of space-age materials. It sounds great, but really you're trading down a lot because you're leaving your network, you're leaving your resources, you're taking out all that living good tissue, and you're putting in something that's just artificial and can never regenerate or repair itself.
Exactly, and you're going to have extremely reduced flexibility. And that's the thing, for you guys that are skiers, you're really dependent on having that flexibility and movement and rotation in your knees that you lose with the prosthesis. And again, a prosthesis has only about 10 years. So if you're planning to particularly be skiing more than 10 years, prosthesis is just not a solution for you. And again, spinal surgery is showing less and less effectiveness, and you'll find less and less surgeons offering it for pain, okay? So that then leads us to how we're helping. Imagine you've got all this debt, okay? How are we going to pay this debt?
Well, this is like, in our analogy then, you go out the back door one day and you trip over something hard, you look down and you find a gold nugget, a big shiny golden one. This could solve all your problems. You didn't know it was there, it's a resource you never knew you had, but it's just waiting to be used.
And that's the thing, every one of you has a golden nugget waiting in your back garden that we can help dig up for you and get working for you, okay? So that's the thing, most of these gold nuggets are hiding in your fat, in your bone marrow, okay? Now, as David always says, it's not like your stomach needs more fat tissue, okay? So we're able to unlock those gold nuggets and start getting them working for you rather than sometimes even against you.
That's right. And so we harvest out the stem cells from the abdominal wall, we transplant them to where your body really needs them. This is not physically possible for your body without assistance. That's what we're here to do. And we put them right where your body needs them. Your body can immediately start regrowing tissue and actually making your joint better.
Exactly. And so the three things that start holding most people back from actually making first contact with us is, firstly, it sounds too experimental. And you know what? 10 years ago, we'd have believed with you. Lots of things that we now see happening every single day was told to us in university that wasn't possible. The advances in stem cell treatment in the last 10 years has been enormous. And so oftentimes when patients are asking me, is this experimental? I'm actually having to reply with, the research that we're seeing for our procedures has got stronger evidence and safer than a lot of the research, a lot of the methods and treatments that have already been recommended to our patients or they've tried before.
Now, you might also be asking yourself the second question we often meet, and that is, oh, this sounds wonderful, but it sounds too expensive. Is it too expensive for me? And I'd like to tell you that the interesting news and the fantastic news we have for you is that you would pay less for this treatment than a woman would pay for breast augmentation or even a facelift in cases. That means that for people to receive increased, better regenerative function in their joints, they're paying less than someone would pay for a cosmetic procedure.
And that's exactly right. Look, no matter what, if you've got joint or back pain, you're going to be paying. You can either pay in monetary or you're going to be paying in lost time and pain, okay? So that's the second thing. The third thing is accessibility. And now this is a big one because this is the whole reason why we actually became stem cell experts.
So a few years ago, we actually both had the same patient. We didn't know at the time that we were both treating the same patient for the same issues. But we had a man with degenerative knees. He had a lot of knee pain. He was a younger man, an unusual case actually with not advanced arthritis in the medical sense, but a lot of problems, a lot of pain, daily pain. He was in trouble at work. He was in trouble at home. He wasn't sleeping well. He wasn't functioning properly because his knees were giving him so much trouble.
And that's the thing. He'd already been operated on both knees for operator's meniscus, and he was worse rather than he was better.
That's right. And the new research actually suggests that meniscal surgeries just make things worse over the long term.
Exactly.
So this man, I had tried painkillers. That's what doctors like to do. We go first with the easy options. We tried some painkillers. It didn't give him much effect.
No. And I tried using more conservative methods of joint manipulation and more general rehabilitation, more specific to get his knees working better. And while we could get results, the things, wasn't long lasting. We had this patient coming back again and again and again on a weekly basis, and you start feeling this failure. You start feeling us in healthcare, our job, we've spent most of our adult lives finding ways to help patients, and we're every day, well before, we're met with patients that we couldn't offer viable solutions for.
That's right. So in desperation, I actually sent a final referral letter to the orthopedic department in the hospital. They took another look at the patient and they sent us a letter back and said, there's no more we can do for this man. His knees are too young, and he's too young and too healthy to receive a knee transplant. He's just going to have to learn to live with his pain. Now, we felt, and Jeremy said this, we felt like failures at this point because, like we say, as healthcare professionals, we try our best to make our life better. And so we started to look for other options. We started to turn to the research. We tried to find out if we could find something that would help there. And we stumbled upon stem cells as a new and growing market and a new and growing alternative for patients with these problems.
They're showing amazingly positive results, but when we came to actually trying to refer this patient to get some type of treatment, we found that there weren't any clinics offering this in Europe. And so if we wanted to help our patients, we actually had to become the experts ourselves. And so that's what we did. Over the last years, we've been using our time and energy, so many thousand hours, finding the world's premier experts in stem cell and pain management and learning their techniques so that now we can offer in Lindesand, only 2 hours away from you, the most advanced, complete, safe and effective stem cell treatment for joint and back pain.
That's right. We also have pioneered stem cells in conjunction with movement techniques that Jeremy as a chiropractor is an expert in, and we are the only clinic we are aware of in this hemisphere that are doing these treatments.
Exactly. And so that then comes our accessibility, and why we're talking to you is, while we've been able to massively help our local community in southern Norway, there's so many in the rest of Europe that are needing help and needing options, and we want to let you guys know that you've got an option, okay? Now, as we say, we've got direct flights to Kristiansand, which is our closest airport, from London, Amsterdam, Copenhagen, and even Oslo. So most of our patients can get to us within a 2-hour transit. Now, we have patients that travel all the way from New Zealand and Australia to get our treatment. So they're traveling 36 hours compared to 36 hours. 2 hours is just a hop, skip, and a jump. And so that then leads us to why we're talking to you today.
We want to offer you our next to local community. We've already been doing this, as we say, locally. We now want to offer the next door neighbours to our clinic.
And so that's why we're talking to you today.
So we've just doubled the size of the capacity of our clinic. We've increased availability. And we think that it's only right and fair to offer this then to our local neighbours, our next door neighbours, you know. So you guys are the natural choice to come to us, and we want you to come to see us. This sounds like you, if you have problems with your skiing, with your joints, and your sleeping maybe not as well as you used to be, your lost function, go down in the link below, fill in the form, let us know, and we will let you know what we can do for you.
Yeah, so to our European neighbours, we're now offering you guys the chance to get this same treatment. So what we're offering is, for the pioneering members, we're offering amazing packages to help get not only one or multiple joints done safe and effectively, and also affordably. So the 3 things you need to do now is fill in the form below, and that'll tell us directly. We'll go through your case, exactly what's going on. We'll tell you if this is something we can help you with and give you a plan. The 3rd thing is we'll organise your treatment to get started so you can start having less pain, more movement, and a better life.
We hope to hear from you soon.